Hello friends, I am Dr. Ankit Gupta and today's video is on tummy tuck surgery and I am making this as a two-part video. The part 1 would be what happens before the surgery, do you need a tummy tuck or not, and what things you need to take care of before the surgery. And the second part of this video would be how is the recovery, what are the risks, what can be the complications, what things you should know after the surgery. Okay, so if you watch these two videos, which we'll post one by one, you will be able to make an informed decision as to if you are a right candidate for tummy tuck and what all things you need to plan in advance. Friends, I am Dr. Ankit Gupta. I am a plastic surgeon and I practice in Delhi at Panache Hair, Laser and Plastic Surgery, and today's video is on tummy tuck and this is part 1 of series in which we will make 2 different videos. So this is a before surgery guide for any tummy tuck patient. Fine. So number 1, the most important, what is a tummy tuck? So tummy tuck is a surgery in which we give a cut in the area where you wear your bikini. So it's a bikini line cut, and through this we are able to take out fat from your back, from your sides, that is the flanks, lower back, as well as the whole of the tummy below your breast. All these areas will first suck out all the fat. After that, we close the diastasis of recti, that is the muscles that have split during childbirth or due to excessive weight gain. Those are closed together in midline, and then whatever excessive skin you have is removed. So there are 3 different components of tummy tuck and usually all 3 are done together. Who is an ideal candidate for tummy tuck? Anybody who has any of these 3 problems, at least 2 of these. So either you have a lot of extra skin or you have a split in the muscles. In those 2 cases, you need a tummy tuck. If you only have an excess amount of fat, only liposuction is sufficient. But if you are a mother and you have had a childbirth, especially after cesarean section, if the muscles are split and if you have a lot of excess skin, you need a tummy tuck surgery. An ideal candidate should have completed their family. You don't want to plan any more kids. Once your family is complete, only after that you should undergo this surgery. What problems can tummy tuck correct? So again, it can remove all the fat, the skin, the extra skin, and the muscles which have split. It can correct that as well. What is the difference between tummy tuck and liposuction? So in tummy tuck, tummy tuck is lipo-abdominoplasty. So it has liposuction along with skin removal with muscle coming together and liposuction. But in liposuction, you are only removing the fat. We are not tackling the extra amount of skin. We are not stitching the muscles in between. Okay, so there is no scar in liposuction as such, but in tummy tuck, you will get a fine line scar in the bikini area, okay, which you can hide in a underwear. Will tummy tuck help me lose weight? Tummy tuck or liposuction, both are not weight loss surgeries. These are body contouring surgeries. Once we are removing significant amount of fat, skin and everything, the weight does come down, but it is not meant to reduce weight. Okay, so if somebody asks me, I would say no, but it does make you lose, say, maybe a 2 to 3 kilograms of weight, maybe 4 kilograms. Okay, how much weight should I lose before surgery? So you don't really have to lose weight before surgery. You should be at your ideal weight or whatever weight you desire to be in future. And once you are in a stable weight, at that time you can undergo a tummy tuck or a liposuction surgery. Fine. Can I become pregnant after a tummy tuck surgery? Yes, you can become pregnant after a tummy tuck surgery, but I recommend you complete your family first, because the whole point of getting a tummy tuck is whatever changes your body had because of a birth of a baby, the extra amount of skin got created, the muscles got split, all those will be corrected. So once you correct it, if you again become a mother, these things will reoccur and you will need a tummy tuck again. So you will spoil the whole thing, but it is not a contraindication. You can get pregnant if in case you decide to get pregnant in future. What types of tummy tuck surgeries are available? So there are different kinds or different names to tummy tuck surgery. The basic I have explained you, that is a tummy tuck. We have started combining liposuction, so a lipo-abdominoplasty in which we do a 360 lipo along with a tummy tuck. Sometimes we even fill fat on the hip dip area. So along with that, we can fill the fat in the hip dip area, which sometimes we say it's a BBL, but it's not actually a BBL, it's an hourglass shape. There's a high definition tummy tuck in which you suck out a significant amount of fat, make the skin thinner so that your muscles are more visible, and you contour the waist in a way so that your waistline is much thinner than your hip, so that you have an hourglass shape. That is again another type of tummy tuck. There is something called as a mini tummy tuck for those females who do not have a lot of loose skin, very little amount of loose skin, or for males who have lost some weight and have a bit of loose skin, for those, instead of making a tunnel all the way up to your rib cage, only a little bit of skin is removed from the lower portion of your tummy and a scar is given, and that is called as a mini tummy tuck. There's something called as an extended tummy tuck, in which those who have lost a lot of weight, the scar would go beyond a normal tummy tuck and it would be extended to the sides, which is called as an extended tummy tuck. So these are a few kinds of tummy tuck. In those who have had a significant amount of weight loss, say around 40 kgs, in those patients we have to do a belt lipectomy. That is completely different surgery. There's another flordelis tummy tuck. These are not the usual. These are for patients who have lost a significant amount of weight. Okay. Now, what other procedures can be combined? So we always combine liposuction. We always combine this skin removal and muscle tightening if required. Now you can add fat grafting to the hip area. We can add fat grafting to the breast area. We cannot add fat grafting to the posterior, that is the back of your hip. We can only do the hip dip area. The back of the hip we cannot do because you are supposed to lie on your tummy after a tummy tuck surgery, and if we put fat in your hip area, it won't survive. We can combine it with a breast implant surgery. We can combine it with breast lift surgeries, but I would rather say an implant, till implant it is okay, but if you are combining breast lift with tummy tuck, we do it only if you are of a normal weight, of your BMI is less than 25 or maximum 28, 29. If you are overweight, then I would say make it into two different surgeries. Okay. What investigations are required? How is the surgery planned? For surgery planning, you need to visit a plastic surgeon, ideally a board certified plastic surgeon who has a significant amount of experience in dealing with cosmetic patients, who deals with tummy tucks very regularly. They will examine you, recommend you what is the right surgery for you. Then we would recommend you undergo a full profile of your blood investigations to see that you are fit for surgery, an X-ray chest and an ECG to see your fitness. If you suffer from anything, the doctor will advise you accordingly. A pre-anesthetic checkup is required. Sometimes we check for your gaps in your abdomen. If required, we might advise you to undergo an ultrasound of your tummy. And if you are doing any additional procedures, additional tests might be required. Okay. What type of anesthesia? We do it under general anesthesia. And what investigations I have already told. How long does the surgery take? Depends on what we are doing. But if I am doing a standard lipoabdominoplasty, somewhere around 4 hours. Yes, you need to stay overnight after the surgery. I would in fact recommend you stay for 2 nights in the hospital and then get a discharge. You will have drains after the surgery. There are few medications that you need to stop before the surgery, and these would be any supplements, any green tea, fish oil, omega-3 fatty acid or multivitamins, any blood thinners if you are on any. Smoking and all you need to stop at least, ideally say 3 months before, but at least vaping and smoking you should stop 3 weeks before your surgery. Okay. So these are the things you should know before your surgery. I'll be making the second video in which I'll be explaining you about the recovery, the results and the risks about the surgery. So if in case you liked our video, please follow us so that you are able to watch our second video, and it will help you make an informed decision on tummy tuck surgeries. Thank you and have a nice day.